Okay, everyone. Well, let's get started. We've got lots to cover today. Thank you so much for joining us for our webinar, What to Consider When Thinking About Your Vaccination Policy. And this webinar is brought to you by the Ontario Nonprofit Network. All right, and my name is Sarah Matsushita. I am the Director of Comms here at ONN. And if you are new to ONN, welcome. It's great to have you here. And we are the provincial network for Ontario's 58,000 nonprofits and charities. And we're focused on public policy, advocacy, and services to strengthen the nonprofit sector, and really to make sure that we show how the sector is a key pillar of our society and our economy. If you are already a member of ONN, thank you so much. Welcome back, and thanks for your support. And your support really helps us to be able to do our public policy, research, advocacy work, and we couldn't do it without you, so thank you. As well, for today on the technical side, if you have any technical difficulties during the webinar, visual lag I know still happens even with Zoom, with the magic of Zoom. So please, first of all, try closing your browser, reopening it. Easy, but it might actually, it does help from time to time. If any other problems, please let us know. You can type your issues into the chat box. We have the ONN team on standby and they'll respond as soon as possible. As well, also very importantly, if you'd like to use closed captioning, please just click on the CC icon in your Zoom window. And any questions about that, please put that in the chat box and our team would be happy to help you. A big question for today is, what about questions? So for sure, please, we encourage you to ask questions, make comments. Please make use of that chat box so it's very interactive today. Our team is monitoring it. We'll be collecting questions. We'll have a chance after our presenters to be able to take some questions. And at the end, for the last 10 minutes, we'll also have a very deep Q&A time as well. So please make sure you add those questions as you go. And to answer our most common question, yes, absolutely. We will have for you the slide deck to share, as well as any other resources that come from the discussion today. We'll share that directly to you by email within a week's time. We're also recording today's webinar as well, so you'll have that recording to refer back to as you're thinking about your vaccination policy. So the technical stuff and housekeeping, but also very importantly, as we move into the presentation before we begin, and really talking about ONN's commitment to Indigenous peoples here in Canada. And I would like to acknowledge that for ONN and our work, we are on the traditional lands of the Wendat, the Haudenosaunee, and the Mississaugas of the Credit. And this territory is part of the Dish with One Spoon, Wampum Belt Agreement, and the Upper Canada Treaties. And I'm also joining from this land. Also too, at ONN, we really do believe that as nonprofits, we must take our role seriously in responding to the Truth and Reconciliation Commission's calls to action. And we seek to partner with Indigenous-led organizations in respectful ways, learning from Indigenous communities about collective ownership, collective enterprise, and sustainable economic and collective ownership. And we extend our respect to all First Nations, Inuit, and Métis peoples for their valuable past and present contributions. We're also mindful too that of broken covenants and the need to reconcile with all our relations. And we know that with truth is a very important part of that process, and that learning about our colonial history and coming to terms with that to restore right relations with each other and with the land. So we encourage you to take action as a nonprofit and what your commitment is to supporting Indigenous peoples. And we have shared some resources, for example, on our website, but also looking forward to hearing your stories. All right, so with that, we would like to open the presentation to today's topic, and we're very lucky to have two presenters who know the sector well and will be able to speak to the many questions I'm sure you have in terms of vaccination policy. Joining us today are James Lenouri and Kirsten Grant. And James is the principal of Lenouri Law, and he focuses on employment and labor law, and covering a wide section from private and public sector employers and individual employees. And also joining us is Kirsten Grant from the Canadian Mental Health Association, Ontario Division. And Kirsten has over 20 years of international HR leadership experience in the professional services and not-for-profit sectors. And Kirsten really believes in empowering people to transform organizations from the inside out. And she's a longtime advocate for psychological wellness in the workplace. And we're so lucky to work with you, Kirsten, in many different ways at ONN in our policy work. So it's great to have you here. Thank you so much. And with that, I'll turn it over to James and Kirsten to start our presentation, and note that please get those questions into the chat box and we'll be taking those as we go. All right, over to you, James. Thanks again.
Thank you, Sarah. It's a pleasure to be with you and deal with this very important, very topical topic of vaccination policies. I've been doing quite a number of them on behalf of my clients. What we want to cover today is a number of areas. I'm going to do an overview of considerations that you need to make when thinking about implementing a vaccination policy, then talk about some of the legal aspects, and we'll talk about some of the contents that you want to include in a vaccination policy, and then I'll review at the end some of the legal issues. If you have questions during the talk, please use the chat, send them in. Kirsten will vet them, and we'll deal with the questions as they come up, and then we can also deal with questions at the end of the presentation. I think I always like doing these co-presentations because you get my perspective from the somewhat higher legal perspective, and then you get Kirsten's perspective being on the ground and dealing with human resources issues and how they're applied practically in the workplace. So turning to the topics, in terms of an overview of this issue, there are a number of factors that take precedence in terms of considering a vaccination policy. These include workplace health and safety, human rights issues, and privacy issues of information of your employees. Now, an issue that I want to clear up is that given the legal issues, it's unlikely that employers will be able to make a COVID-19 vaccination mandatory. That is, you won't be able to compel your employees to be vaccinated as a condition of employment. I think it's confusing the way it's portrayed in the media. What may occur, and in fact, as we talk about the policies, you'll see that it is an aspect of the policies, is that vaccination may be mandatory in order to receive certain services, but being vaccinated in itself for legal reasons, as we'll get into, will not be mandatory. And I think that's an important distinction as we're listening to the media and the whole issue of whether in Ontario the government will make vaccinations a mandatory vaccination policy. So I hope that clears up that confusion for you as you're listening to the media and as public health protocols develop. Now, saying that, employers may strongly recommend in a vaccination policy and in their statements and their mandates that their employees get vaccinated. And the reason is that, as we know, that COVID-19 vaccination is the best method of responding to the pandemic. So you can recommend to your employees that they be vaccinated in conjunction with their employment. In order to proceed with a vaccination policy, you have to conduct a fact-driven assessment backed by evidence, convincing evidence in your workplace that there's a need for the policy. Now, this issue or principle has been evolving since the issue of vaccination policies has begun. And it's really now, I think, being driven by the fact that vaccination is seen as the best method of responding to policy. But you still, in terms of the legal arena, you need to show that there is a need for a vaccination policy and vaccination protocols in your workplace. If you're continuing to have everybody work from home, obviously the need for a vaccination policy isn't as driving. If you're contemplating your return to work, then of course that's where you want to be looking at what are the protocols, what are the safety situations, what's our assessment. I've had clients who have said we just can't deal with the spacing issues. We can't comply with those kind of protocols. So it's that kind of assessment that you would need to look at. What spacing, what distancing, what PPE do you need to put into place? In addition, a vaccination policy is evolving, and it has to evolve in sync with the evolving information and protocols and directives that we are receiving from public health officials and from the government. So those all need to be taken into consideration. So the question, does your organization need a vaccination policy? Well, as human resource persons and employers, I submit that there are two aspects that you need to consider in terms of whether your organization needs a vaccination policy. The first that strikes right to home and the heart of your legal obligations is that under the Occupational Health and Safety Act of Ontario, employers have a legal obligation to ensure the health and safety of the workplace and to ensure the health and safety of your employees. So as employers, you have that obligation, and you also have not only there's organizational liability, but you have personal liability under the Occupational Health and Safety Act. So that should be the foundation for you're looking at whether to implement a vaccination policy. Is what are our obligations and our duties under the Occupational Health and Safety Act to provide the protections. The second aspect that for your consideration, as I've talked about, is that COVID-19 experts say that vaccination is the most effective way to respond to the pandemic. So with those two foundational aspects, you can consider whether your organization needs a vaccination policy, taking into account the other aspects that I was mentioning in terms of what is the setup or what are the parameters in your workplace to provide to comply with the protocols. If you're considering implementing a vaccination policy, you have to take into account that your policy must be reasonable and measured for the particular workplace, and whether you can provide less intrusive alternatives that would be appropriate. As I said, I think with the findings or the information that we have from the experts that vaccination is the best resource to respond to the vaccination, that will underlie it. But you have to, from the legal perspective, go through this exercise of determining whether the vaccination policy is the most effective measure for your workplace, or whether there are alternative measures that you could take, such as just following protocols, following the PPE, the distancing, the sanitizing, whether that would work in your workplace. Then you need to evaluate and weigh the evidence that's available regarding the health and safety issues in respect to COVID-19 against the employee human rights and privacy interests. That's where the legal balancing will take place. What do we need to do in order to meet our obligation to protect and provide a healthy, safe workplace, balanced against legal rights and entitlements that employees have in the workplace? If you're implementing a vaccination policy, some other considerations, again, you'll need, and we'll talk about this a little bit more fully in a moment, is determine how the human rights accommodation requests and protections will be addressed with respect to the protected grounds of disability, sex and pregnancy, and or creed. You also need to, as a separate issue, consider how the employee's personal health information with regards to vaccination will be safeguarded and protected and then destroyed when it is no longer needed to be retained for your COVID purposes. And again, you'll need to review the policy on an ongoing basis to make sure that's in place for the ongoing review, to determine that it continues to be reasonable in light of the evolving public health guidance that we're constantly receiving. Let's drill a little bit closer into some of the legal aspects. You have to consider human rights prohibitions against discrimination on the basis of a protected ground of disability, sex, pregnancy, and or creed. We have the Human Rights Code in Ontario that we're subject to, and there are human rights legislation across Canada excuse me, and at a federal level. In addition to considering the prohibitions and how you'll respond to them if an employee raises them, you have to, under the human rights legislation, consider to what extent you can accommodate employees who either decline to be vaccinated for a reason under the Human Rights Code, or they're medically contraindicated to receiving vaccination under your legal human rights duty to accommodate a person who has made a claim to the point of undue hardship. And we'll talk more about that as we go through the program. Under human rights legislation, there are two ways in which a vaccination requirement can be challenged. The first is a medical objection. In the case of a medical objection, the employee would have to provide substantive evidence from a doctor, from a medical specialist, that the COVID vaccination is medically contraindicated for that person. And again, this is why I say vaccines cannot be made mandatory, because there is this exception for medically contraindicated. The person just cannot receive it. And medical exemptions may include allergies to the vaccine components, a history of Guillain-Barré syndrome, which is a muscular dysfunctional syndrome, or other health ailments that make the vaccine risky for the individual. Those have to be taken into account, but the person has to provide adequate medical support from a specialist. The second is a religious or conscientious objection. In the case of a religious conscientious objection, an employee has to provide substantive, and I'm emphasizing this, significant basis for the objection. They have to be convincing that it is fundamental to their creed or position or their faith. And the example that a person might use is a vaccination undercuts their faith in God's ability to protect their body from harm. Now, that's a fairly broad statement. We could all take that position if we want, but that will not cut past the threshold for human rights protection. The person would have to go further than that and show the background in terms of their faith beliefs, that they practice them, that it is inherent. So it's a deep level examination. Another example is persons who are opposed to vaccines that were developed or tested using cells derived from fetal tissue of elective abortions. Again, it has to be at a deep level in terms of persuading that the exemption should be applied. And the reality, I believe, is with regards to the religious or conscientious objection, it would be an exceptionally small number of people who will be successful in making that claim. There was a case in BC where a person brought a human rights complaint that they, with regards to masking and following directives on the basis that they had the right to challenge the government. Well, that lasted about 5 seconds with the Human Rights Commission there. It just does not make creed or the substantive significant arguments that a person would need to make. Now, that's not to say, as I said, I don't think that this area or this area of human rights will be that common, but I certainly can see that medically contraindicated would be a more common issue raised by employees. So how do you accommodate staff who choose not to be vaccinated? It must be assessed on a case-by-case basis, having regards to the specific needs of the employee. That is, the employee, again, going back to, must provide not only evidence that they fall under the protection and the exception, but they also must participate in the accommodation aspect. What is required, and then the employer determines if that can be accommodated in the workplace. And as I talked about earlier, given the societal interest in responding to the pandemic and beating the pandemic. So depending on the nature of the workplace, reasonable accommodation might include requiring the employee to wear personal protective equipment, to maintain physical distancing in the workplace, assigning the employee to work from home, or if you're not able to do any of those, placing the employee on a temporary, non-disciplinary, unpaid leave of absence until it's safe to return to work. I do not advocate for termination of employees. I think the law has set up that with the infectious disease emergency leave that employees can be put on temporary leave, their jobs would be protected, and the termination, unless it's just I don't see as a typical or common response when they have these other remedies that can be used. If you're going to introduce a vaccination policy, you need to begin by, as I said earlier, performing a fact-based assessment of the risk posed in your workplace and the extent to which a vaccination policy can be used to mitigate them. You need to consider, again, what alternatives to vaccinations can be offered, taking into account your accommodation-related obligations. You need to devise ways to properly communicate the vaccination policy requirements in your workplace, and also include in that is quite clear the consequences for non-compliance. And then you need to also take into account planning in terms of how the policy will be communicated, and that it will be consistently enforced across your employee complement. A lot of my practice in the last number of months has been dealing with vaccination policies and preparing them on behalf of clients. We've gone through a process in terms of developing a precedent or prototype of a policy. The policy that we've developed in our office is modeled after a policy developed by Sunnybrook Hospital and adapted by several other hospitals in Toronto, and then modified or adapted for the needs of particular clients. So in terms of looking at what you would include in your vaccination policy, my recommendation, and we're including in the policies that we develop, is you set out a policy statement that the employer supports and recommends vaccination. As Sarah said, my practice is broad ranging. I represent a number of healthcare institutions, and one of the issues there is, I have to say as a layperson, I'm astounded that they don't have 100% people who agree to be vaccinated, who are able to be vaccinated. And we focused on a healthcare organization should be supporting the science of vaccination in terms of its mandate, in terms of underlying its vaccination policy. You need to include in your policy that the employer will follow public health guidelines and directives and government directives as they continue to evolve. The important aspect of the policies we've been developing is a requirement that an employee indicate one of three things: that they have been vaccinated, and you can require the confirmation of vaccination that we get when we are vaccinated. That the vaccination is medically contraindicated, and again require the information from the person's medical doctor to support that. Or the third option that a person has to declare is that they decline to be vaccinated. So one of those three options, you narrow down the focus of the policy to the employees indicating one of those three options, so that you can manage your staff, manage your policy, and manage the protocols that you need to have in place. In addition, you want to include in the policy assurance that there's a privacy policy in place, and outline how that will work. As a policy that we work from sets out who the privacy commissioner or designate manager is in the workplace, and that person or his or her designate will be responsible for maintaining the privacy of employees with respect to vaccinations. It's important in your policy that you state and set out that the employer will attempt to accommodate, that you will attempt to meet your legal obligations under the Human Rights Code. However, and this is a big however, in terms of a policy, you inform the employees through the policy that it may require the wearing of personal protective equipment and distancing and other measures that may be different from vaccinated employees, that people will be treated differently. And that's not based on us as lay people thinking it's the right thing to do. It's based on the science that the best protection is vaccination, and those who aren't vaccinated may be treated differently in order to ensure that the workplace and fellow employees are safe. You need to inform people that changes to working conditions and duties and responsibilities, including temporary unpaid layoff, may be part of of the response of the organization to persons who are not vaccinated. And that's persons who are medically contraindicated or persons who indicate that they decline to be vaccinated, that it is clear to them that there may be changes to their conditions in order, and again, I can't emphasize enough, in order for the employer to meet its obligations under the Occupational Health and Safety Act to provide a safe workplace. In the policies we've been developing, we set it up in three parts. The first part is setting out the positions of the employer with respect to the statements and mandate, and then there are two additional documents. The second document is a COVID-19 acknowledgement. This is a document that the employee signs. It sets out the three options that we talked about earlier, that the person confirms that they've been vaccinated, that the person sets out that the vaccination is medically contraindicated, or that they decline. Those three options are set out on this document. In the acknowledgement that the person will sign and submit to the organization, but also keep a copy of, it's set out that it reiterates that without vaccination, that the employer will accommodate persons who aren't vaccinated to the extent possible in order to meet its health and safety obligations. You've set out also in a transparent manner that for the protection of other employees and visitors to the office or organization, it may be necessary to disclose that an employee has not been vaccinated in order to satisfy people that the workplace is safe, or how people may want to respond themselves to situations where they're dealing with people who aren't vaccinated. I'm dealing with situations of medical salespeople who my client is looking at implementing the policy, but one of the aspects that they're dealing with is that health organizations are requiring any salespeople and visitors to be vaccinated. So that, in thinking that through, you can see how that rolls out within the policy. If the employer cannot, if in-person visits are required for their sales meetings, then whether you can look at an alternative of doing it virtual, of having virtual meetings, or whether in fact there will not be work for that person and they may have to be temporarily laid off. Those are the kinds of issues that you'll have to deal with in terms of your policy and in dealing with outside organizations. In the acknowledgement section, the employee must acknowledge that they understand that without vaccination, job duties, the location of their work may be changed to comply with public health directives, and that may include being put on a leave without pay if the employer cannot accommodate and provide work for that person in order to meet their health and safety obligations. It's in the acknowledgement also, you set out that the employee may be required to follow protocols other employees who have been vaccinated may not be required to follow. So you're putting that in place as well. What we hope is that the policy will motivate people to be vaccinated. I mean, in Canada and Ontario, we have a high rate of vaccinations, from what I understand, and that will continue. But it's getting over the smaller percentage of people who, for whatever reason, are hesitating to be vaccinated, and encouraging and motivating those people to be vaccinated if you have a vaccination policy in place. The third part of the precedent vaccination policy is an attestation by the employee, that the employee attests and confirms or affirms that they will stay current with public health and government protocols. Of course, as an employer, you're going to be providing those to your employees as well. But that they will, the understanding is that they will read them and adhere to whatever protocols are in place, whether it's personal protective equipment, whether it's masking, whether it's distancing, and as they evolve and change, that the employee will comply and stay current with them. Importantly, on an ongoing basis, and I know from reports from my clients that it's becoming fatiguing and tiresome with regards to reporting symptoms. Some of my clients require reporting on a daily basis when people are coming into work. Others on a trust basis of employees, but that the employee attests that they will report if they are experiencing any of the symptoms of COVID-19. The third attestation is that the employee will agree and acknowledge that they must follow the COVID-19 requirements and protocols for working on site, including PPE, and also for those persons who decline to be vaccinated, that they understand that they may be treated differently in order for the organization to meet its health and safety obligations. Finally, an acknowledgement in your vaccination policy that the employer reserves the right to require rapid testing. Again, that's all. Rapid testing is based on your assessment of the needs of your workplace and your organization. But you want to, if it isn't a requirement at this time, you want to reserve the right that if things change, and again, we're all listening to the news and hearing that the cases are rising, we're going into a fourth wave, that you, as the directives evolve, you may want to implement and reserve that right to require rapid testing. An important part, of course, before implementing any policy, and particularly this policy, a vaccination policy, is you need to introduce that the policy is going to be implemented and introduced, and you need to train them on the applicable requirements and on disciplinary sanctions for noncompliance. We have the word disciplinary in the slide. I would encourage you, and I encourage my clients, to stay away from the word disciplinary unless it's in extreme situations where a person is not complying with, for example, masking or any of the public health and government directives, that you would move towards that. Otherwise, you're looking at the accommodation aspect. How can we accommodate you, and what measures can we put in place to maintain your safety and maintain the safety of the workplace and your fellow workers? Indicating that if you do fail to properly train, introduce the policy, go through what the requirements are, it can open the door to legal risks, including the possibility of your policy being found to be unenforceable. The policy that the template precedent policy that we've been working on and adapting for various client situations. There has been some initial queries, let's put it that way, from some staff groups, and we only have I've only had one client who is unionized where the bargaining unit is raising some issues. Ironically, in my opinion, is that it is a healthcare organization, and I find, as I said earlier and repeat, I find it astounding that professional healthcare workers are resisting a vaccination policy in any manner, especially one that has been worked on to be as balanced as the one we're introducing, and importantly modeled on other healthcare organizations' policies. But you still need to make sure people understand the policy to avoid pushback and be able to respond to pushback. Again, with the underlying, we have an obligation to ensure the health and safety of our organization. We are an organization that supports, supports the science and supports that vaccinations are the effective way to respond to the pandemic. In your training, you need to provide virtual training, question and answer sessions for folks. The heart of the policy that we've been developing is the three aspects: declaring they have been vaccinated, identifying that the vaccination is contraindicated or declining. That those three aspects are the heart of the policy, and employees are required to make that election, and they will be required to submit their elections, and the employers will follow up with people who are hesitant or tardy in providing their responses. If you're not already doing so, you need to provide additional resources on vaccine information and vaccine hesitancy. One of the aspects of the policy that we've been working on and from is that the University of Toronto provides a series of webinars with vaccination information that they are making available to employers, so that persons who decline to be vaccinated, you can require them to at least view these seminars on vaccination, and hopefully it will encourage people who have questions or who are hesitant to proceed to be vaccinated. The last thing, as you know, for the human resources folks who are with us today, consistently enforcing the policy from the time it is introduced is important. As I was just saying, the requirement for submitting the election needs to be followed up. Make sure that employees do that, setting out your standards and accommodation requirements in terms of PPE, spacing, following the public health directives that are provided, to make sure that the policy is properly enforced. And of course, again, repeating that as the managers, that you're on top of the changes and evolving directives that we're receiving from public health and from government. Prior to the webinar, we had a number of questions, and just look at several of those, and then we'll move to the legal aspects. The question that came in was, can employers require masks and distancing indefinitely? The answer to that is there's no legal necessity to lift mask and distancing policies at any specific time. And well, in fact, at the present time, the public health advising is still wearing masks indoors. Currently, the requirement is to wear a face mask, to wear a face covering is compliant with public health, as I said. And these measures are from the World Health Organization, our federal public health agency of Canada, and most particularly your local public health and government protocols. And just if I can slip back with regards to the contents of a policy, you would also want to indicate that you are relying on particularly on public health information, but particularly your local public health information. That is the most on the ground information that we can receive as citizens and as employers in terms of what are the needs, what are the requirements in your particular community. I do work for the Association of Local Public Health Agencies, and of the 34 health units in the province, they all deal with their particular community's needs and situations. So it's important, in my opinion, that your policy refer to and you have a connection with your local public health unit. The question going forward, as the pandemic declares and hopefully resolves itself is lifting or modifying the mask and distancing policies. And that will be, again, a decision taking into account what the local public health directives and possibly provincial and government directives, but it will also take into account, and this circles back to what we were talking about at the beginning, is the need for you to assess what the requirements and needs are for your particular workplace. Like I was saying earlier, a client who says, we just have trouble with the spacing issues, our lunchroom, common areas, office areas. You need to assess your particular circumstances with regards to your obligation to make sure that the workplace is safe in terms of your lifting, particularly mask and distancing or any other health public health directive that you're subject to. Mandatory regular rapid testing. Again, that's a question that came in. As an employer, you can mandate that staff receive rapid testing as part of their job duties. Again, you need to have gone through the exercise of determining that it's required and reasonable for your workplace. And again, you are subject with rapid testing, similar to vaccination. An employer can be subject to that. There's the person has under the Human Rights Code has a medical condition that precludes them from taking the test and or receiving the test, and the other objection against testing on religious or conscientious grounds. Again, that is subject to significant evidence from the person, and this would be where if you're not satisfied with the information that you receive, you certainly can go back to the source of the information to ask further questions. But if it is apparent that the person does not have valid grounds, that may lead you down into the disciplinary aspect, or more likely, if you were calling me to ask about it, putting the person on leave, just getting them out of the workplace until either the situation changes or they change their position on taking the test or being vaccinated. Now, we talked about undue hardship here. Undue hardship is under the Human Rights Code is very significant. It takes to the point of financial hardship, serious financial hardship. It's a high test for employers to get over. But in the situation where we're dealing with the pandemic, we're looking at the societal needs in terms of responding to the pandemic versus individual rights, and that's the balance that I see will be occurring if these cases are challenged and go to courts or adjudication. So let's talk in terms of the final section. In terms of what are some of the legal issues, or how have these issues played out legally? There haven't been a lot of cases. There are a number of employment cases on the issue of whether temporarily laying someone off constitutes a termination at law. Those are working their way through the courts, and it's not a clear answer that we've received. In the introduction of a vaccination policy, I'm not aware that there have been any cases that have been challenged. As we talked about, I would hope that employers or that employees and unions, and from what I've heard on the news, and more unions are coming on side with introduction of policies. Arbitrators, however, have considered the enforceability of mandatory testing and mask policies in union environments during the pandemic in residential care sectors, and in these cases, arbitrators have held that for these policies, for masking and testing to be enforceable, and I would suggest it will go forward to a vaccination policy. The policy must be consistent if you're unionized with the collective agreement that you're under, or employment agreements or legislation. Employment standards legislation. The policy must be reasonable. The policy must be clear and unequivocal, which is why I indicated earlier, setting out what the parameters are for your policy and the policy in your workplace. It has to be brought to the attention of the employees through training and meetings and discussions. And it is clear, it must also be clear that a breach may result in discipline or certainly layoffs or being treated other than other employees are being treated. And again, that would be through your training. A policy to be upheld must be enforced consistently by the employer following its introduction. We talked about that earlier. There are several cases that I just bring to your attention. In a case from last year of a nursing home, the union filed a grievance challenging the reasonableness of a policy requiring all workers in the nursing home to be tested for COVID-19 every 2 weeks. The arbitrator dismissed the grievance and held that the employer's policy requiring compulsory testing was reasonable in the context of the vulnerability of the population of the home, the seriousness of a potential outbreak, and in accordance with the public health and ministry guidelines. It's important to note in that policy, it did set out the accommodations and what alternatives to testing there could be, and that was taken into account by the arbitrator as well. The employer's decision to discipline an employee for failing to comply with the policy, with the requirement, was upheld by the arbitrator in that case. In a second case, Ellis Don Construction, the arbitrator upheld that the intrusiveness of an employee's compulsory screening program, as evaluated against the goal of preventing the spread of COVID-19, was reasonable. Again, that takes us back to the balancing that you need to do that we talked about at the beginning, your health and safety obligations versus responding to COVID and protecting your employees and your workplace from the spread of the COVID-19 virus.
James, I'm just sorry to interrupt you there. Just doing a quick time check. We've got 12 more minutes left of the webinar. So just wanted to make sure we've got a lot of questions that I've just been compiling. So would love to get to those as soon as we can.
Okay, we're just about done.
Thank you.
We're on the last slide. In the analysis, the arbitrator noted that the risk of COVID-19 spread was increased by the nature of the construction industry, and employees could not maintain social distancing. There was a tangible risk of COVID-19 spread while the employer had numerous outbreaks on their sites, and the transmission was apparent. Measures taken to protect the privacy and dignity of the individuals were in place to protect information. The screening test was minimally invasive. There was no evidence that the mitigation efforts in place had significantly reduced transmissions or that all workers were testing. So meaning that the implementation of the screening program was proven to be required and reasonable. You need to stay on top of your information. I put resources for Toronto Public Health, Ottawa Public Health, and the Ontario Nonprofit Network also has resource information that you can access. We'll provide further information in the update that's coming out after the webinar. In summary, in terms of considering introducing a vaccination policy, you should consider it given the balancing that we talked about, but you also need to balance that with the medical considerations and human rights protections that an employer cannot mandate that all employees be vaccinated, but you can respond to those persons who decline to be vaccinated for a valid reason. The policy must comply with public health directives, be reasonable for the workplace, and can recommend receiving the vaccine, but must provide for accommodation of employees who legitimately do not want or cannot receive a vaccine. So with that summary.
Awesome, great. Let's jump into questions.
To the questions part of the program.
Thank you. So James, a couple of questions. I'm going to go through these quickly because we've got a whole bunch. We won't get to all of them, but we'll certainly, for folks that you've asked questions, we're recording them and we'll share them afterward with some answers to go with. But one of the things for James to ask you is having a recommendation or recommending vaccination, a policy that recommends vaccination. If a recommendation, can we legally not hire someone if they are not double vaccinated?
Yeah, you can ask that. You can ask that question. Because if your policy is that your assessment is that vaccination is in the best interest of your workplace, then that question can be asked. That's a good question. It's come up in terms of from my clients as well.
Okay, great. So just there's another question
now
to reinforce.
taking into account again the exceptions, medically contraindicated. That would be an exception where you would have to accommodate a person,
Okay.
or if the person has a valid religious conscience. But I don't even want to touch on that. It's
Okay.
not worth. To me, it's not worth going to.
No, for sure. And I think that just that one of the questions that's been asked a couple of times is that so that legally, can we legally enforce vaccination in the workplace?
I'm not sure what legally.
Yeah, Kirsten, do you want to maybe just be sort of the wording? Yeah, do you want to jump on this one?
Because yeah, go ahead.
James, correct me if I'm wrong, but this is how I've understood our many conversations around this. You can't mandate or force someone to get a vaccine. You can't literally hold them to the ground and give them a vaccine.
Right.
But what you can do is make vaccination a requirement for working on the job or for certain working conditions, or to receive pay and be paid for doing that work. And that refers to the sort of final option you could go to if you require people to be in the office, you require them to be vaccinated to keep your staff safe, and they will not say that they have been vaccinated, then you can put them on unpaid leave.
Yes.
So I think it's semantics, but it's important. You can't force anyone to get the vaccine, but you can require it to participate in the workforce and in the workplace under certain conditions.
Okay, great.
That's right. You can make, as we talked about at the beginning, you can make vaccination mandatory in order to carry out your duties in the workplace, to ensure the workplace is safe. You cannot, as you said, Kirsten, hold somebody down and require them to be vaccinated. If they decline to be vaccinated, then you put into place the responses that you mentioned, and deal with that way, and hopefully encourage the person to be vaccinated.
Okay. And exactly. do people have to prove medical exemptions?
Yes, you have the right to get satisfactory information from a specialist to support the person's position that vaccination is contraindicated.
Okay, great, thank you. And wondering too about. Yeah,
sorry, an important qualification on that. Getting a note from a naturopath or an herbalist or even a chiropractor or a foot doctor is not sufficient. It has to be a medically trained professional who has expertise in the area that they're claiming they have an issue with medically.
Okay, great.
That's correct. That's correct. An employer in any medical situation has the right to be satisfied. We're all lay people, unless there's some doctors out there. We're lay people. We have to rely on medical information. We have to be satisfied that medical information is valid and supports the position. So you can push back, as was said. A note from a non-specialist may not cut it. You have the right to be satisfied that the information responds to the question.
Okay, thank you. Thinking about different types of jobs in organizations. So can you treat different job roles differently? So for instance, frontline workers have different requirements than say office workers?
Yes, that's all part of your assessment of what your needs are in the workplace, and will be in particular areas of that workplace. If you're talking frontline, a receptionist or someone who's dealing with clients or patients coming in, yeah, you certainly need to assess what the needs are for those particular circumstances are.
Okay,
and
great.
And in those situations, you may have, if someone's dealing with clients, they may not want to deal with. There may be a requirement that clients be vaccinated. And if not, then other accommodations need to be put in place. So yes, you need to look at the particular circumstances for the application of your policy.
Okay, thank you. And thinking about accommodations, if you were to require rapid testing, would an employee be required to pay for it if your organization couldn't afford to provide those tests?
Well, that could certainly be the subject of a legal challenge. As we know, public health, in particular the government, has been encouraging employers to create the circumstances where people can be vaccinated or testing to prevent the spread. So I could see that being a challenge from an employee who you require to pay to receive the testing. I would suggest in those cases that you contact public health. If you're doing your due diligence and carrying out your responsibilities, and you cannot afford to have the testing that you believe is required, contact your local public health unit, and they can provide resources to assist you with that issue.
Okay, thank you. We have some resources to share as well with everyone here, that we know there are some free testing resources available. Thinking about volunteers, that came up a lot. Obviously, the sector really relies on volunteers. Thinking about how the rights of volunteers who have been vaccinated to work in a safe environment. What are some of the, like, for example, some of the things like how much can you mandate volunteers since they are not paid employees?
You're looking. I mean, that can be a separate issue under occupational health safety, but let's put it in the context of the pandemic. You're trying to do. An organization is trying to do its part to prevent the spread of the virus. So you have the underlying basis is that you have a duty to make sure that the workplace and anybody in the workplace is safe. So you can make those requirements. You can make requirements of volunteers. They can fall under your policy, and your policy can be developed and adapted to reflect the outside persons or volunteers that they are subject to the policy.
Okay, thank you. And the same would apply to clients, I would think, as well, since It is everyone in the workplace. Okay.
Yeah, especially like I said earlier, you may if you're dealing with clients, you may have employees who are reluctant to deal with clients who aren't vaccinated, and that needs to be dealt with and accommodated.
Okay, thank you. Thinking about other accommodations such as mask wearing, I know you referred to that in a previous slide, but just thinking about, how can organizations deal with for volunteers who, including social distancing and there are other volunteers they may have to work with, can that be then imposed of mask use?
The answer is yes. It's a public health directive. So people need to comply with what the law is and the directives, and even going beyond that, as we talk about your assessment of what the needs are for your workplace. And I don't know if Kirsten has anything you want to add on to that.
No, James. No, you covered it.
Okay.
Okay, good. And
just jump in, Kirsten.
Yeah, please.
On these things.
I will. Yeah.
Okay, great. Thinking about contact tracing, I have a couple of questions around contact tracing. So, for example, are there or should there be requirements to conduct contact tracing with users and volunteers? And how could that be implemented?
Contact tracing is a public health responsibility. So you have an obligation. People, if public health has instituted contact tracing, they will be in touch with you in terms of what your requirements are. So you need to know what your requirements are from your local public health unit with regards to recording who's in your building, and so that to enable them to be able to do the professional contact tracing.
Okay, thank you. And a question about privacy. What are the legalities around disclosing an employee or volunteer's personal health information to anyone, assuming that it would be illegal to release that information?
Of course, in any privacy situation, and I do want Kirsten's on the ground response to this. You have the obligation to maintain privacy, but again, there's a balancing between what are the needs in terms of preventing the spread of COVID-19, a balance against the individuals, and that's where I talked about earlier that you put in your policy that there may be circumstances where you have to be disclosed, where it can be disclosed that you have not been vaccinated, or even you have been vaccinated. So it's that balancing, and I think the protection from the pandemic will win out.
Yeah, I'll only add on this point that if you design your policy well, what people are declaring is whether they've been double vaxxed, whether they have a medical reason or a conscientious reason to not be vaccinated, or whether they refuse to declare, really. And you're not saying, I haven't been vaccinated, you're saying I refuse to declare and I will do the training and then we'll see where we get. And so I think what's important to realize is if the only people whose status is being revealed by having a bifurcated mask policy is that someone has declared they are fully vaccinated. And if that person is not comfortable with people knowing they've been fully vaccinated, they can choose to comply with the masking policy. So it really isn't a violation of personal information or medical information if you have properly drafted your policies.
Okay, and it comes down to policies. A question was asked around templates. I know that's a difficult one because, of course, there's different applications, different circumstances, but wondering if we'll look into it for folks who are asking to see if there's any kind of samples that we would be able to provide. All right, we're looking at the time. Unfortunately, we have run out of time. I noticed too that some questions around clients and volunteers, that could be its own separate webinar. I agree. We will definitely share more information with you as a follow-up to this. But thank you very much, everyone, for joining us. Thank you very much, Kirsten. Thank you, James, for all of the information and trying to provide that really important context for what we are working in and therefore what we can do and how it would apply to each of our organizations and their own circumstances. So thanks again for your help, everyone, in bringing these information, these questions to light. Really important. We'll follow up with you after the webinar. We also have a webinar on August 25th around reopening, safely reopening your space, whether it's offices or space that you use. So we encourage you to go to our site at the onn.ca and sign up for that, and look forward to hearing and seeing you at our next event. Thanks very much, everyone. Thanks again, James and Kirsten. Have a great day, everyone. We'll see you again.
Thanks, everyone.
Bye.